Hello to everybody. We see people entering in through the waiting room. We'll give folks just a moment to populate here. So good to see so many new and familiar names. Without further ado, we'll get started. My name is Emily Vorty, and I'm an associate director in the White House Office of Public Engagement and the administration's liaison to disabled Americans. So it's phenomenal to be with you all here in what is crunch time, a critical time to talk about home and community-based services and this administration's proposed investment. I want to kick it over to our headliner today, our keynote, Congressman Cedric Richmond. Congressman Richmond is a former congressman from Louisiana, former chair of the Congressional Black Caucus, and he is our current White House Office of Public Engagement director and senior advisor to the president. So, Congressman, we are so grateful for you being with us here today. I'll turn the floor over to you. Thanks so much.
Let me thank you, Emily, and let me say good afternoon to everyone. As Emily said, my name is Cedric Richmond. I'm the director of the White House Office of Public Engagement and a senior advisor to the president. I'll try to make my remarks brief because we're eager to hear from this afternoon's speakers, self-advocates and direct service providers from Iowa, Georgia, Maine, and Pennsylvania. This moment in American history is of critical importance for the over 60 million Americans with disabilities. At present, the caregiving infrastructure is unable to support the thousands of disabled and aging Americans in need of support. Self-advocates and their families are forced onto long waiting lists for years on end. In the meantime, families are made to show the exorbitant financial burdens or seek care in high-risk environments outside of their community. This strain on the caregiving economy has been further exacerbated by the weight of the COVID-19 pandemic. And so what I really want to do is remind you that the Biden administration is here for all Americans, including those navigating disability, regardless of their diagnosis. The Build Back Better agenda's proposed investment in home and community-based service provides historic funding to ensure disabled Americans are able to receive the supports and services they need at home and in their communities. It would also provide necessary investment in the crumbling service systems that support people with disabilities and aging Americans. High quality care for Americans with disabilities and inextricably linked to adequate resources for caregivers and service providers, and an investment in home and community-based services that will create tens of thousands of high quality, well-paying jobs across the country while giving better service. It also would go outside of the disability community and would make sure that we create more jobs with living wages and making sure that the adequate infrastructure would allow our caregiving professionals, whether in their first years of their careers or in the 13th year, to enter the workforce, stay in the workforce, and be able to support a family. These caregiving jobs would also provide workers with the necessary benefits and, most importantly, the ability to collectively bargain. Build Back Better funding would also allow providers to expand services and programming, create the infrastructure needed to support those currently without the services that they need, and provide funding for states to address the home care workforce crisis. Last week, the Vice President held a kitchen table conversation highlighting the importance of Build Back Better plan for the sandwich generation, the millions of adults who are caring for multiple generations or family members with few or no formal support. The resource burden is exacerbated when a family member's disability or disabilities necessitate round-the-clock, medically complex care. Limited access to high-quality care leaves many Americans to fill the gap in professional caregiving by providing unpaid care to their loved ones. We know that this burden is disproportionately felt by women, further contributing to the gender wage gap and reducing American families' economic security. It's evident that investment in home and community-based services cannot wait. Disabled Americans are counting on us. Aging Americans are counting on us. The caregiving workforce is counting on us. So I just want to remind you all that where we are now is we're at the crunch time in terms of doing something that no one has done in our generation, and that is to make sure that we invest in families, that we fulfill the needs that they see, and not needs in theory, but needs in reality. And when we start talking about our disability community, our elder community, we need to invest in them. We have a way to do it. We have a way to pay for it, would not add to the debt. And it's just time that we do it. This is a values vote for us. And this is what we campaigned on. This is what we believe in. We're excited to finally be getting here where we're at the finish line. And we hope that soon we'll be able to celebrate with you on something that was a hard fought victory, but one that is going to pay enormous dividends for the families across this country. So I just want to thank you again. I'll turn it back over to Emily, and just in closing say it has been great to be alongside of you, fighting to get it to the finish line, but it will be better to be alongside of you when we are implementing these life-changing investments. So thanks a lot.
Thank you, Congressman. We appreciate your time as always, and your continued advocacy for us in this community. As has been mentioned, disability, the caregiving economy has no geographic bounds. And that is why today we have pulled together advocates' voices from Maine, Pennsylvania, Iowa, and Georgia to talk to you about why the next few days, the next few hours are so critical. So first, I want to turn it over to Kyla Clausen, who is from Avoca, Iowa, and is currently on the wait list for home and community-based services. The waitlist for a HCBS waiver, despite a progressing neurological condition. So Kyla, I will turn it over to you. Thanks for being here with us to share.
Hello, my name is Kyla Clausen. I'm from Avoca, Iowa. I'm 37 years old with an unknown progressive neuromuscular disease. My first symptoms started a little over 5 years ago, the day before my 33rd birthday. That morning, I woke up and my left leg was so tight that I couldn't straighten it. Over this past year, my condition has rapidly deteriorated where I am now at 60% lung capacity. Over the last 5 years, the disease has slowly taken over my body, including my ability to smile. 2020 was the worst year for me, and COVID made it even worse. Closed offices and people working at home made it harder to get answers and apply for assistance. After a surgery related to my disease, I was no longer able to work. I lost the ability to walk independently for long distances. I have increasing balance issues. My right side has become weaker. I am no longer able to drive. I was never a homebody and was always on the go. I felt trapped. And to top it off, I had to move because my house was no longer accessible to me. Ironically, I had been working as a caregiver for 18 years. Now, I need someone to give me care. I had applied for Social Security disability insurance and Medicaid for employed persons with disabilities, so I could apply to get on the home and community-based services waiver waitlist for the physical disability and health and disability waiver programs. I am one person among about 17,500 waiting for help in Iowa. The list is so long that it could take 1 to 3 years before I can get any help. There's a good chance I may not live that long. This year I encountered new challenges. I started having increased weakness and fatigue issues. I was losing the ability to swallow. Last month, I had a feeding tube inserted in order to eat and get nourishment. I need to be on a PAP machine due to my low lung capacity. A PAP is a form of non-invasive ventilation, NIV, therapy used to facilitate breathing. But my managed care organization has denied it. I use crutches to walk short distances and a power wheelchair for long distances. When I get tired, my speech slurs, making it hard for people to understand me. So, I've been training how to use a gaze-enabled speech generative system to be able to communicate. There are no emergency slots on the waiver, except for those applying for the brain injury waiver. I wrote to my state legislator in March of 2021 and was told they are looking into my situation. I am still waiting for a response. I wrote to Iowa Department of Human Services Director Kelly Garcia in February 2021 to explain how I need help in my home with homemaking, transportation issues, and how I get exhausted easily after routine tasks due to further decline in my disability. Director Garcia had one of the department's income workers call me to follow up. She had seen that I was receiving food assistance and commented that it was a nice way I could save money that way. I replied that there is no saving money when you have to keep buying adaptive equipment to live on your own. She then told me that I don't qualify for any interim help until I get on the waiver, because I make $600 over the limit on SSDI. The income worker asked if I have any mental health issues because that would get me services by the Mental Health and Disability Services. I said, no, I do not. She then stated that she could see how my condition could cause a person to have a mental health problem. If I did have one, I could have received help from Mental Health and Disability Services. Iowans with physical disabilities do not receive any case management services unless we are on one of the state's waiver programs. I have applied for every waiver program that am I eligible for and am on the wait list for all of them. In Iowa, only the Intellectual Disability Waiver Program is linked to Money Follows the Person funds. I asked, what other options are available to me? The Department of Human Services worker told me I should call 211. The person on the 211 call from the United Way information line told me to call Iowa Compass, which is a resource line that helps people with disabilities. But, unfortunately, in my case, I'd already tried everything they suggested. This led me to some strong advocating on my own behalf. I wrote a blog piece for one of Iowa's blogs. After it was published, I was soon contacted by a managed care organization asking if I looked into assisted living facilities. I told her, no, because assisted living facilities doesn't amount to skilled care. Some of my needs are considered skilled care services. If I had my PAP machine, which uses non-invasive ventilation, NIV, therapy to facilitate breathing. There are only 5 nursing homes in Iowa that have respiratory programs. The one closest to me had about a 50% survivability metric regarding COVID within the past year. The other 4 nursing homes are hours away from my family and friends. I've gone through all the steps I could think of to get the services I need. Other people with disabilities have to move out of state to get the care they need. I deserve to stay in my own home as my choice of residence. Transportation is another issue. With medical transportation, I am picked up an hour and a half before an appointment that is only 40 minutes away. Sometimes I have to wait another hour after an appointment before I'm picked up to be taken home. If I was on the waiver and they'd paid caregivers, I wouldn't be wasting about 2.5 hours waiting at appointments. Also, in my area, I don't have a dial-a-ride option or any other ways for transportation. I would have to pay a driver $40 an hour from the time they left their house and get me back home. If I wanted to leave my town at all to go elsewhere to combat social isolation, which I do experience, I am unable to afford those fees. I fear that I will not be able to continue living in my home. If I would decide to live in a nursing home, after 6 months I could then leave and start getting waiver services. But in Iowa, if we have a physical disability and leave a nursing home, there are no programs to help us get reestablished in our homes and communities. Though, people with other disabilities have access to these programs. Going this route would cost taxpayers more, it would take away my independence, and, most likely, make my health deteriorate faster. I want to live in my own home the rest of my life and be active in the community of my choice. With waiver services, I could have the help to do that, and it would decrease some of the physical burdens I now have, increase my well-being, and possibly give me more time to live. Thank you for letting me speak to you today.
Thank you, Kyla, for speaking to us and for sharing with us. Something that you named will be a theme throughout our conversation today, which is just how much red tape, how much work it is to advocate, to self-advocate in order to maintain self-agency, independence in your own community. Again, we're going to hear that throughout our time together today. And that is why, we hear time and time again that this investment cannot wait. It is critical for ensuring life-saving support in the setting of one's choice at home in communities for millions of Americans. So thank you to Kyla. I want to turn to Keyston White now. Keyston has a spinal cord injury that he sustained in 2001. He is from Lawrenceville, Georgia. He is a member of the United Spinal Association board and is currently navigating funding and logistics for 24-hour care. So Keyston, thank you for being with us. And I'll let you take it away.
Hi, thank you for that, Emily, and it's an honor to serve on this roundtable, sharing my experience with all the other incredible stories. As Emily said, I'm a quadriplegic, and I had a spinal cord injury. Coincidentally enough, I had my injury on September 11th, 2001, 20 years ago. During football practice on my high school campus. The result of my spinal cord injury was a catastrophic injury policy that came from the school that would cover medical expenses. But even with that, my family had to fight for me to get nursing coverage under the policy because as a quadriplegic, I rely on hands-on duty care. So ultimately, after my parents had to fight to get that coverage, what I ended up with under the policy was 24-hour private duty nursing care and the policy also paid for my supplies, medical supplies. In 2019, I had contacted my policy counselor to find out the status of my funds with no response. Fast forward to 2020, my nursing agency alerted me to unpaid invoices. So I contacted my insurance company, only to discover that my counselor had left the company and without notifying me, and the funds had run out, and I wasn't notified about the funds running out or that I was even getting close. And so immediately I lost my nursing coverage. Very quickly, my family and we had to hunker down and start looking for caregivers and paying out of pocket. And it's been very trying to look for and find individuals that can give quality nursing care. And so most of the candidates that we have found come with high rates, and yet they have little to no caregiving qualifications and or experience. Luckily, we were able to find some individuals that can help. And so what my care looks like now is that I have one nurse who has taken a significant pay cut to work with me out of the kindness of her heart. And I have one night nurse that works with me. Well, she's not a nurse, she's a caregiver that works with me 5 nights a week. And she's the only caregiver I have at night. And then I have one other caregiver that works with me a couple days a week. And after that, my parents pick up the slack, and my parents are older, they're in their retiring years, and so they're not physically able to help do the work that they used to help me. But 2 days a week during the week, they get me up in the morning, help get me dressed so that I can be prepared for work. And they work Saturday and Sunday nights with me. And so that affects all of us, certainly our stress level. And it hurts me seeing my parents that should be relaxing now, having to take care of me. It's an incredible physical hardship on them. And yes, and so that means I only have 3 caregivers that I'm able to pay, and then the rest are my parents. And it's caused a financial hardship on me, despite the fact that I'm an attorney. A lot of people might think that because I'm an attorney that I should be set, I'm golden. But the truth of the matter is that even with my salary as an attorney, I'm still having to rely on my parents to help me pay the cost of nursing care. And frankly, that situation in and of itself, it's not sustainable. And so I'm really hoping that there could be change, because to be frank, as far as being an attorney, I'm not sure, I don't know how I could have made it to and through law school had I not had the nursing care that I have had. And with the nursing care that I have now, there's no way I probably would have made it this far. So that's my experience, and really hope to see some change and better access to nursing coverage.
Thank you, Keiston. Another theme, Keiston, that you brought up that we hear so many on this call hear so frequently is, folks thinking that just because you're employed, just because you have a salary, that you must be able to cover out of pocket the cost of care. And that is simply, as we know, not sustainable, nor should be the expectation. The cost of high quality care is exorbitant. And so thank you for your candor in your share today. Next, we have Ken Rhino and his wife, Joanne, who is with him, who is his primary caregiver. Ken is a quadriplegic and is from Kunkletown, Pennsylvania. I will turn it over to you, Ken and Joanne. Thank you for being with us here today. We're excited to have you.
Hello.
Hi, Ken. We can hear you. Whenever you want to begin, you have the floor.
All righty. Hi, my name is Ken. As Emily said, if you have trouble hearing me speak, it's because I'm talking with a trach. I have my wife Joanne here by my side. At any given time I'm unable to speak, she will speak for me. I am a C5, C6 quadriplegic and have been since 1979 up until 2019. I did work full time until 1999, and then I worked part-time until 2019, when my life took a change for the worst again. I had, basically it's called stress heart attack with Tokotsubo cardiomyopathy. I was in the hospital for 9 months. 5 of those months was in cardiac care unit. and 4 of them was in the rehabilitation hospital. And I'm sorry about the phone ringing. I depend on reliable care services, which is very hard to find. For instance, the first nurse assigned to me showed up first day, stuck the day out. The second day, he came in halfway through the day. He said he had to go out to his car and make a phone call. And I didn't see him again. So I was left here by myself and living on a vent, which I did for 3 to 4 months after I came home. I actually had to suction myself, which wasn't advisable, but it was either do that or possibly die. So then we got another nurse out for some until COVID hit. And she had teenage children at home, and one was with special needs. So she was also laid off. And then we were stuck with no nurses. My wife is a physical therapist by trade her whole life. She did home care physical therapy. And people were denying the home care therapy because of the fact of COVID. Nobody knows myself better than me and my wife. And I am on the UPMC Community Health Choices. I'm gonna have to let Joanne speak for a little bit for me.
As Ken said, you don't really know what it's like to go through this unless you actually live with a disability 24/7. And Ken, when he had the second catastrophic event in 2019, as he was being wheeled out into the ambulance, he said, "Please don't let me die. I want to live." And my husband's a fighter. He has a strong will to help people, and he wanted to remain active and help other people. And he does consider himself a person with disabilities because they're physical disabilities that you can see. But he is differently abled and has a lot to offer society. And we all like not to be invisible, but to be out there helping people. So when COVID hit, I was laid off because work was not as available because of COVID. And I realized at the same time with the nurse also not being able to come out, that if it was going to be and he was going to survive, it was up to me to provide that 24/7 care, no matter what financial situation that we were in, no matter how exhaustive it was to make phone calls to try to get assistance. It was really up to the both of us to brainstorm and figure out how to get through this one day at a time. So I was lucky that while before COVID, I was able to stay in the ICU with Ken 24/7 and also at the Good Shepherd Rehab Hospital. And as Ken says, an amazing thing happened there. Watching people constantly, I kind of got on the job training, but then they realized that they needed to do caregiver training with me because I asked so many questions and made such a pest out of myself. I had a hunger to know how to help my husband. So all that training after COVID was put into action, and we've been able to carry on quite well, I think. We're a good team. His care is tremendous. He weaned himself off the vent in 3 months at home. I'm not sure he would have been able to do that in the hospital. He does still require to be on a humidifier at night with oxygen. He has a chest vest, a cough assist machine, nebulizers. He has a PEG tube. He had a stage 4 pressure area in the hospital that we healed up at home. Something that they said probably wasn't going to happen without surgery. While he was in the hospital, he almost lost both of his legs above the knee, and he also required multiple bronchoscopies to clear his lungs, surgery to paste his lungs to his chest wall, multiple heart surgeries, a pacemaker, a cardiac window. So many times he almost died. He was on the brink of life and death, but we're people of faith, not just in God, but in all of you, for your prayers and your support. We have been able to meet a lot of people through this process, talking to the Office of Long-Term Living, and then with Community Health Choices, and then with our representatives from Pennsylvania to help me to become an exception that a spouse can be a caregiver. However, there's no sustainability to that. Every month we're reviewed to see if Ken has progressed or declined, which is fine. We just tell it like it is. And so Ken's approved till basically December. They say probably even till March, but after that, there is no sustainability to providing his care with me. I mean, I could actively work as a physical therapist. That was my chosen career. I loved it. However, again, if it's going to be, it's up to me. I can be here 24/7. I can be reliable. I can be supportive. However, in March, I will continue to do that, whether we have the funding or not. We may lose our house. We're already in forbearance. We had to be on an on-track program for our utilities. So I guess, do you have anything?
It's a foregoing research to find out what kind of help is available. It took us 6 months to be able to have Joanna as a paid caregiver. And I don't know why that's not law, because it works the best when you know yourself the best, and so does your spouse. So I want to thank you for all that you do, all that you all do. And as long as I can keep fighting and advocating, I am a member of United Spinal. I'm on the board of IAM, which is Northeast Pennsylvania chapter for United Spinal. IAM stands for Individual Abilities in Motion, and we do great things. And I hope to keep getting better. So thank you all for everything you do.
Thank you.
Thank you, Ken. Thank you, Joanne. Once again, just such a compelling story. The sacrifices that are made personally, professionally, all in the name of taking care of loved ones and self-sustaining care. again, with agency, with dignity, and in your own home. So this is why this investment is so critical, as you all know, and I'm just grateful for your witness, particularly your ability to speak to the context in Pennsylvania. Our final storyteller is Carol Dunn, who is being supported today, joined today by Bill Fertig. Carol is here to share the story of her son, Chris. And while Carol is speaking, I'm going to put a photo of Chris up on the screen. Bill is with United Spinal. He is the director of the Resource Center and worked closely with Carol and with Chris on Chris's case. So they are here today to talk a little bit about the context. And Carol and Chris are from Lewiston, Maine. So Carol, I'm going to turn it over to you and Bill as well. Thank you both for being with us here today.
Thank you, Emily. On behalf of Carol, as she cues up her video, I'll just give a little background while that's happening. And the scenario is that we met Carol halfway through an ordeal. Carol's with us right now. Carol, would you share with the group your Chris Dunn's injury story?
I will. You know, as Chris's mom, I may get a little emotional, so I'm going to try not to, but I'm going to try to be Chris's voice for him today. Christopher was 43 years old and enjoying a 4th of July with his family in a pool that he's been in since he was 5 years old, having a great day, but something happened and he dove into the pool and he didn't come back up. Well, that day he sustained a catastrophic spinal cord injury that left him paralyzed from the shoulders down and on a vent. It also caused him to lose his vision. Christopher, the first few weeks in the hospital, we lost him several times, and the doctors, the odds were not good for Chris. But my son is a fighter and he will fight till the end. He spent a year in the ICU fighting just for his right to live, basically, and to get to rehab. It was always our plan for Chris to live at home. It was never an option for us, for Chris to be anywhere but in his own home. The doctors wouldn't advocate for Christopher because of the level of injuries that he had. And without their recommendations, we couldn't get him into any rehab facilities. I was struggling to fight against the system. The doctors at that point had felt that a treatment plan for Chris would be for him to go to hospice. Well, that's not what we wanted. And Christopher said, "Mom, I can do this. I just need a chance." So Mom got on the phone and I wrote letters to Senator Collins, and I wrote letters to Senator Angus and Governor Mills. And they were very nice, and they called back and offered their help, but I needed something more. In the state of Maine, spinal cord injury, the numbers aren't there, and doctors were saying, "We don't know what to do to help you." So I got online and I started searching, and I found the United Spinal Association, and I think I just emailed them a line and said, "I need some help." And you know, the next morning they gave me a call. And without their help, I wouldn't have had Chris for the last 3 years. They were astounded, as I am, that for someone with Christopher, his injuries were severe, yes, but he was not a hospice patient. But because there were no facilities in Maine and nobody really knew what to do, because he did survive and he was on a vent, he was told that we don't know what to do with you. And I have pages from Maine to California of facilities that turned Christopher down. But we found one. Shepherd Center in Atlanta gave us a chance. It took a lot of negotiating. We had to get them to accept our insurance. It was a vetting process. It was a lot of meetings, a lot of work. But in July, a year after Christopher was hurt, we got on a plane and went to Atlanta. And those people had their arms open and were ready for us. And Christopher, within a matter of weeks, was off that vent. They said he would never breathe on his own, but he did. Because Shepherd listened to Christopher. Chris knew his body and he knew he could do it. And after a year of being in the ICU with no range of motion, his arms, he was so contracted. But you know, Shepherd knew what to do. And look at that picture. That is my son, I think a month after he got to Shepherd. This is somebody they wanted to go to hospice. I can't thank United Spinal or Shepherd enough. Christopher believes that living at home is more than a personal preference. It's his right. It speaks to the quality of his life and his ability to spend time with his son and with his mom and his friends, to watch football games with his friends, to hang out with his friends, to be comfortable and live his life on his terms. He didn't want to be warehoused in a facility somewhere where he couldn't be himself. But, and to speak from a business point of view, the cost of him being in that ICU was roughly $5,000 a day, where getting him home might be $300 a day. It was hard for us to understand how we had to fight so hard. Both of us, it makes sense to us when we think of the positive financial, emotional, and physical, the benefits of those things when you live at home versus being in a hospital. It just makes sense to us. We don't understand why we had to fight so hard for those things. Speaking from a mother's point of view and Christopher's main caretaker, I will say we do have a nurse. We have 2 nurses that come in 4 days a week so that I can work and keep us in our home. Insurance never pays for all of his medications or his supplies, but we're able to do it with me working. And then I take care of Christopher at night and weekends, except for those 4 days when I go to work. And you know, going to sleep at night, listening to my son and his sister laughing out there, sometimes at my expense. Well, that's priceless. That's what life is all about. And as a caretaker, caring for my son at home is a privilege. It's a joy to see him every day. It's a labor of love. But you know, the burden is not his care. The burden is the lack of nursing care, the lack of home health support. The burden is the insurance issues and the logistics of getting him back and forth to the doctors, the logistics of getting blood work done, the logistics of just trying to get any resources to even get the equipment that we need to keep him at home. That's the burden, not the caretaking. Chris's injuries were catastrophic. His body doesn't work anymore. But you know, Chris is not his body, his heart, his mind, his soul. And he has every right in the world to live at home with the people he loves and to be comfortable. The worst part of all of this, if you ask, is not Christopher's injuries. It's that he needed his strength to heal his body, but his energies were needed just to fight for the right for him to come home and to make that happen. Christopher believes as a country we can do better than we're doing. Home health care should be available when needed. And right now it's just too hard to get and maintain. We really need some changes out there. We need some help. We live in a great country and people do get hurt. It doesn't mean they shouldn't live at home and be loved. And I'm sorry, that's Christopher is worth it. We need to do better.
Thank you so much, Carol. Bill, do you have anything to add? I know that you were instrumental in this process.
Absolutely, Emily. And my first comment is, Carol, thank you so much. Obviously, it's hard to share his story. We go back. We've been working together sometimes daily for a couple of years. And, you know, it's the denial of care in certain settings is just unbelievable. It's literally unbelievable when you're facing it day by day. And so I thank you so much for hosting this roundtable at the highest levels of discussion, because this is exactly what needs to be, explained as considerations are underway for funding appropriate care for people at home. And I thank you for that.
Thank you, Bill, and Carol, again, for sharing Chris's story and for being part of this conversation. Steve Lieberman, who is the Director of Policy and Advocacy with the United Spinal Association, and Alex Benowith, who is the Vice President of Government Relations, are going to close us out and help us to just, again, kind of refocus on what is at stake here, again, in a very critical time as actively negotiations are underway with the reconciliation bill that this investment is tied to. So Alex and Steve, thank you for your coordination, your advocacy. I'll turn it over to you to close us out, but know that we're here right alongside you.
Thank you, Emily. Alex, you want to go first?
Actually, my video hasn't been enabled yet, Emily. Great, thank you so much. Great, awesome. Steve, you want to touch on the COVID piece a little bit and then I can finish it up?
Sure, Alex. We've heard some really incredible stories today. Some of the stories touched on this, but these stories are just four of the many that we hear on an ongoing basis from United Spinal, from our members, from folks in our community. And these problems have really been exacerbated by the COVID-19 pandemic, and they've really been exposed by the COVID-19 pandemic. We know that there are ongoing structural problems with the caregiving sector in the United States, the way that it has been set up, the way that we know where it needs to go. 1/3 of the COVID-19 deaths in the United States have come in congregate facilities such as nursing homes. And at one point, but prior to the start of the vaccination campaign, that number was higher, it was around 40%. So, you know, it's an outsized percentage of the deaths have come in these facilities, and it just shows why we need to have folks living at home. The pandemic disrupted the already unstable caregiving workforce, and you know, far too many people with disabilities have had to scramble to find new caregivers or else face the possibility of being forced into an institutional setting, which, as we've said, is not where anyone wants to be, nor is it in the case of the pandemic has been shown to be a safe place to be. And I'll turn it over to Alex.
Thank you, Steve, very much. Very important to highlight that. I really wanted to thank Director Cedric Richmond and Emily Vordy, the White House, for putting on this important roundtable on this critical issue. And thanks to all of our storytellers, in the community, Kyla, Keaston, Ken, and Chris and Carol. Really appreciate it. Thanks to Bill as well. Really important to hear these stories, to not forget we are part of the community, so we mustn't be forgotten. And obviously the caregiving system, as you can see, is not doing the job it's supposed to do for the society, for people with disabilities specifically, and the direct care workers and the caregivers that go along with that community. People are having to make difficult and unheard of choices about how to provide care for their loved ones. So as you can tell, as you heard from everyone, people get stuck on waiting lists for years. Family members are forced to become unpaid caregivers, and it's just not sustainable, as you can clearly see from hearing the stories today. So I just wanted to thank everyone again, and United Spinal continues to fight for this issue for our community, and we'll continue to do that. And thanks to the White House for their focus on the need for investment into HCBS. So thank you so much, Emily.
Thank you, Alex, Steve, all of our panelists, everybody on the line today. To echo Congressman Richmond, we are right here beside you in this fight, and we look forward to celebrating, hopefully with you very, very soon, and implementing this funding. The time is now, and this couldn't have come at a more pivotal moment in our fight for this funding. So thank you all. We look forward to connecting with you again soon. Please stay in touch. Bye-bye.